Fox 8 and Cleveland Clinic Children's Hospital are teaming up to bring you our Kids Art Gallery. We're going to feature the work from some of the creations from their art therapy patients, along with artwork from your kids at home. So here to talk about the importance of art therapy for kids is Meredith McCulloch. She's an art therapist at Cleveland Clinic Children's. Meredith, thanks for being with us this morning. I want to first kind of talk about what it is and the importance of art therapy.
Hi, thanks for having me. So art therapy is really the combination of psychotherapeutic techniques and the creation of art used during the therapeutic process to help enhance an individual's well-being and quality of life, however that might look for them.
So Meredith, we talk about the importance of art therapy, and these kids are in long hospital stays, and so their experience can obviously create anxiety, and obviously parents are with them. But how is that helping with that, and also maybe even improving healing?
So for kids, it's often hard for them to express themselves through words alone. They might
Hmm.
developmentally not be able to do that yet, or it just might be hard for them to articulate their feelings. And we've found that the creation of art and play, all of those creative ways of expressing themselves can really help them communicate. And it's a universal method, all children across all cultures. And we really use our knowledge of art media and our knowledge of child development to help enhance kids' abilities to communicate.
We're looking at these beautiful pictures of these kids, and they range. I mean, we just saw a baby there creating a masterpiece. So, how different is art therapy when it comes to really the babies and then the older kids?
Yeah, there's a lot of variety and it's really tailored for to the individual. For the babies that are in the hospital for a long time, we still want to provide developmental stimulation and help them meet those developmental milestones, even though they might be stuck in their room. So we're working on providing a bunch of sensory experiences for them, helping develop their fine motor skills. And for older kids, it's about helping them express themselves, working on managing anxiety, managing pain, and for the healing process, we're not only working on our individual therapeutic goals with the patients, we're often supporting the medical goals as well. So if a kid
Sure.
needs to be out of bed after surgery, we might get them out of bed and do art with them while they're sitting in the chair. Or if they need to work on drinking more, we might have them take a sip after each color they use.
Right, it's kind of tailored to each kid. So you have bedside and you have group sessions. What are you seeing with these kids and how they're improving, getting maybe out of bed and going to these group sessions to be with other people?
Well, the rewarding part for me is typically when the kids first come to the hospital, especially if they were previously healthy and it's a new environment to them, is they're
Mhm.
often very anxious. They hear the door open and they start crying, and as their treatment and their time in the hospital progresses and they become more comfortable with you and they look forward to seeing you, they look forward to their hospitalizations and treatment because they know they'll have these opportunities to express themselves.
And what is art therapy like for those with long-term chronically ill patients? Is that kind of like a day-by-day thing because it's quite a bit of time that they're with you guys? Where do you even begin?
Well, really, when they first come, it's about developing a relationship with them, helping them feel comfortable, and then we work on goals that tailor, to the individual patient. If they're really having a difficult time with anxiety or having a depressed mood, we might really focus on that throughout our sessions. If they're coping pretty well, we might work on enhancing their coping skills, helping them really develop expertise in a particular medium. It just depends on the individual.
Meredith, really anybody can benefit from art therapy. So if somebody maybe is looking to get into that, they just don't know where to begin or where to start, what do you recommend?
hmm there's quite a bit of articles on Psychology Today about entering art therapy as a career field. There are a lot of local resources because we have a local graduate program, so people who are interested in pursuing it as a career can look there. And there's also quite a few art therapists out in the community because of that graduate program.
This is something you've done for a while. What's the feedback from not only patients but also parents and families? What are some of the feedback that you're hearing?
What I hear a lot from parents is that it helps with their coping to see their child enjoying and looking forward to something. It helps them feel better as well because it's so difficult for parents to feel helpless in watching their child
Mhm.
endure all these medical treatments and not really feel like they can do much for them. So to see the child start to thrive in the hospital and have good experiences and good memories there,
Yeah.
helps them deal with those experiences also.
Meredith McCulloch, been working with the Cleveland Clinic Children's for a while as an art therapist. We appreciate your perspective. We're excited to team up with you guys and show some of these great creations on the show.
Thanks so much.
Have a great day. Thank you. Thanks for all you're
You too.
doing as well.
Thank you.